California, like New York, a pretty difficult environment, lots of practices, lots of competition. And so what's the differentiating narrative? And so for us, getting to see musculoskeletal ultrasound and EMGs as a differentiating factor to take something that's subjective, make it objective, and help us help our patients better and faster. I mean, if I just summarize it simply, that's probably been the, patient narrative, because we use that every day, right? So if you don't believe in what you're doing, and if you don't think it's going to help your patients, then it'd be really hard to create a new program for our clinic. The second piece, I think, for me as an owner, as a therapist, looking at Southern California not being the cheapest place to live, looking for an opportunity to create a higher value service that can afford higher wages in our neck of the woods. And so that was something that was huge for me, as I had been in the career for 20 years and I had played all the games, push volume, push, modalities, all those things. And for me, I didn't see how we could continue to keep up with the needs of our team. And then from just the clinic perspective, offering a diagnostic service has really put us kind of in an elite category of clinicians. I spent a lot of time on the sports fields. I didn't think it would really impact that area as much as it has, and yet they love to ask me questions, and again, only enhancing our reputation amongst both the physicians as well as the coaches and the patients and the normal people in our community. Because none of them really care what an ECS is as far as in the normal community, but the physicians and stuff, that carries more weight.
Something you brought up, the physicians aspect, and I would like you to elaborate a little bit more on how do you manage relationships with physicians and the diagnostic testing that you offer in your practice? Because I'm sure you have physicians who love the fact that you do diagnostic testing. You have some physicians who are indifferent. You have perhaps a couple of physicians who do not care in particular for you doing diagnostic testing. What are these relationships? How they are cultivated, and how do you go about managing them?
Yeah, I mean, I would say we have all three of those kinds of relationships. And what blows me away is, I'll speak about the difficult ones. The ones that love you, that's easy. The ones that don't. And I remember going into a local neurosurgeon's office with our ultrasound, and he kind of thought it was nothing. And then we did a quick ultrasound of his carpal tunnel, and he just thought, he's like, holy smokes, you can actually see the median nerve. I mean, he had no idea how good the images were. He must have been thinking ultrasound from many, many, many years ago. And then when we started talking about electrodiagnostics, he's like, oh, let me be clear. I will never send an EMG to a physical therapist. And I was like, whoa. I mean, again, not trying to rock the boat, just it is what it is. Well, within a year, he was sending almost exclusively to us for EMG. And he was the single most important physician in getting us a contract with one of the larger managed care groups in this area, which I found almost comical. Like, here you are going from one extreme to the other. And I think, honestly, it was the quality of the reports that speak for themselves, because although I think few physicians are maybe that bold to make a statement like that, they're probably thinking it, because you have some on the fence or not really engaging in the conversation, and maybe they're in a pinch and they send you one, and then all of a sudden you're seeing a lot more. And as we begin that part of the conversation with our referral sources, that's been a surprising thing. It seems like the quality of the work speaks for itself. I only know what I was taught through HODS. I only know that piece. And so the reports seem to hold up well. And I always ask for EMGs from if they get them somewhere else in the community. And it seems like we do a good job. Physical therapists work hard. We're grinders. And so again, we like to do the things that we're taught, and we like to do it well. And so I think that's really helped our reputation as it relates to those physicians.